Hello, I'm Subramanian from SumanTV. Indian pharma industry is helping so many Indians for years together, and moreover, Indian pharma industry is known as the old pharmacy. And however, Indians' food habits and then other habits completely changed. Like people started eating from outside, started smoking, started drinking. Because of this, they got into a lot of lifestyle disorders. One such is blood pressure. Today, we have a session engineer sir with us who is having more than 30 years of experience in pharma industry. He has built so many brands in pharma, and we wanted to understand how alcohol is causing the elevated blood pressure. Hello, sir.
Hello, Subbu.
Sir, we would like to say thanks to you for having us here today to discuss about this topic. And the topic is like how this alcohol is increasing blood pressure.
Okay, Subbu. Thanks a lot for having me on this channel,
It's pleasure, sir.
SumanTV, and
Yes, sir.
it is always nice to be with you.
Thank you, sir. Thank you.
See, this is one topic which is very romantic. We are
Particularly
seeing
for
in
Telugu states, actually.
Yeah, Telangana, where when the childbirth takes place, then also alcohol is part of life and culture.
Yeah.
When death is
alcohol.
also there, that is life of part and culture.
Correct.
And most interesting part, I am a teetotaler. But being a teetotaler, I have the understanding
Medical understanding.
and something very interesting to share about. So let me start with one saying by William Shakespeare.
Fantastic, sir.
He's one of his quote in Henry, the drama. He said, "You take all my fame, but give me one pint of alcohol."
Alcohol. Okay, that is the
Just
crazy
imagine the power of
alcohol.
that alcohol,
Correct.
which rules the mind of great intellect like Shakespeare.
Yeah.
Now we had another quote that there is no better creature created by God
Okay.
than wine.
Oh, wine.
Only thing you must know how to handle it.
Okay, that is important.
So today's topic is all about how do you handle wine. But I tell you that in the European countries, it is believed, it is practiced that wine is a great health tonic,
Yeah. Particularly
For
for
the matter,
heart, people
yeah.
says.
especially in the Mediterranean Sea area.
Okay, sir.
All these countries, it is part of everyday life. Every day they take alcohol. Now we have to understand one thing, that like Europeans are big fan of wine,
Wine.
which is hardly 13 to 14% of alcohol content.
Correct.
But in India, it is all about whiskey.
Whiskey. Correct.
And
that is what important
At
actually.
the level of whiskey, you simply go to 40%.
40% alcohol, sir. Yeah.
That is what whiskey is 40%.
Yeah.
Right. How a normal individual handles alcohol,
Okay.
not only while he is ingesting that, but
Okay.
how his body handles
Okay.
is totally different from how a hypertensive handles.
Okay. So these are
Because
the two
body
different
has
ways.
changed. Now, few very simple things which we have to understand, that alcohol is wonderful when it is taken in the limited quantity. So we say there are three category of people, those who drink alcohol. One is binge drinkers,
Okay.
another is average,
Okay.
and the last category where you find lot of people in Telangana is heavy drinkers.
Heavy drinkers. Yeah.
So the best way is to be an average drinker, and average drinker is not more than 2 drinks per day.
2 drinks per day.
Per day.
Do we call it average?
No, I am saying it average sitting in Telangana because imagining life without alcohol is difficult here.
Yeah. That's true, sir. I agree with you.
But ideally, recommended drink in per week for the male it is 5.
For male, 5 times.
If 5,
Okay.
and for females it is 4 times.
4 times, sir.
4 times.
This is recommended, sir.
Yeah, it is fine. It is
Okay.
manageable. The body can handle. Now
Okay.
we have to understand what happens when you take alcohol.
Okay.
See, when you take alcohol, some good things start happening to your body.
Good thing.
What happens? Your blood vessels will relax. So your blood pressure will be under control.
Okay.
Now, your GABA receptor will be inhibited.
Okay.
Your NMDA receptor will be activated. So your reward system, the wish to appreciate, wish to reward, wish to get rewarded, because the dopamine and serotonin level start going up.
Okay.
This happens very fast.
Okay.
Then you become suddenly very generous
Okay.
and very inclusive. This is happening because alcohol gets start absorbing in the stomach itself, the
Yeah.
proximal part
Okay.
in the stomach itself, and from stomach to duodenum, it is absorbed.
Okay.
Right.
Okay.
Then it reaches circulation.
Yeah.
It starts relaxing your blood vessels.
Okay.
So you feel very good.
But where the elevated blood pressure is
I'll
coming
tell
into,
you.
sir?
It's a magical thing. I tell you. There
Okay.
is nothing. Shakespeare said one. There is nothing more beautiful than alcohol in this world.
Oh, great, sir.
And why it is so, we understand. So what happens when it goes to the brain? Then first your judgment is clouded.
Okay.
and your inhibitions are gone.
Inhibitions will go away.
Gone.
Yeah.
So you'll be relief of anxieties,
Okay.
unforeseen fear of the future, which is very typical with today's generation and people.
Okay.
Right? Even if you are happy, you try to imagine that something may go wrong. These all feelings will just simply evaporate once you take
Alcohol.
first 2 pegs of alcohol.
Okay. Okay.
Now, till now it is alcohol. Alcohol per se is not very dangerous.
Acha.
What is dangerous is the toxin produced due to alcohol in the body, and that is acetaldehyde.
Okay.
You remember chemistry lab,
Yeah.
that even because you have to handle acetaldehyde, you have to wear gloves,
Yeah.
put mask, put
Okay.
apron in the lab.
Okay.
So liver starts converting alcohol into acetaldehyde. So the first place where it damages is liver.
So the first thing is going to be on liver.
Same acetaldehyde,
Yeah.
when the concentration starts building up when you drink,
Okay.
your blood vessels, instead of relaxing, now they will start constricting.
So you mean to say that when the excess amount of alcohol is
Yeah.
going inside, that is where these all actions will
The
take
actions
place.
will start.
Okay.
So if you drink more and more, then typically alcohol and acetaldehyde both is going up. Now that is where the body starts experiencing toxic effects. So the judgment is blurred. Your cognitive ability declines,
And coordination goes haywire.
and the coordinations will go. You will lose the balance, and if acetaldehyde becomes more, because there are certain people where the expression of gene cytochrome P452E,
Okay.
which is at a higher level, acetaldehyde conversion will be much higher. So that will cause them do vomiting.
Okay.
So these are the symptoms.
Okay.
So average drinking
Okay.
is going to help
That means 4 times in a week.
4 to 5 times in a week.
No, that is also
And-
high, sir.
I'm saying it's sitting in Telangana.
Okay. Okay.
I cannot prescribe like a doctor because I am not one.
Correct. Correct.
But what I am saying is based on lot of readings which I have done. It is very similar like that diabetes will damage your kidney, but question is when.
Correct.
If it does after 20 years,
Yeah.
if I started at 30, 50 years I am through, no?
Correct. Logical.
So that is where we have to understand that alcohol in limited quantity is very good, because
Yeah.
it is helping us to offset the risk which is triggered due to the conditions like stress.
Stress.
Now, when it causes hypertension, when the quantity goes high, when acetaldehyde concentration start increasing, the first target is liver,
Okay.
and after liver, the second target is the portal vein, because your alcohol from or the blood from whole body will going to the liver.
Okay.
So the liver converts and sends to the body.
Yeah.
It does the nonsense.
Yeah.
Only good thing God has made, acetaldehyde is a very short-lived chemical. It gets converted to acetate, and acetate finally becomes carbon dioxide and water.
Okay. So it will
Right.
come through the
But
urine.
question is, if you keep on drinking peg after peg, then the body can't handle it.
Okay.
And then it starts manifesting itself in various symptoms.
Okay.
Second thing, long-term alcohol use will make your heart muscles weak. These are the people, those who have got very high risk of cardiomyopathy. So now it is not only hypertension, but
Okay.
it will start triggering something more difficult and unmanageable for the doctor.
Weakening the heart muscles.
Heart muscles.
When
So
it
one
is
of
a
the target
long-term,
is heart muscles.
Okay.
First, everyone knows for one Amitabh Bachchan movie that alcohol will cause liver damage. दारू पीने से liver खराब होता है.
Correct.
Everyone knows.
Correct.
That is very simple, because acetaldehyde is causing damage.
Absolutely.
Second thing is a cultural challenge. If you see in Europe,
Yeah.
people will take raw salads with alcohol.
Raw salads with alcohol.
They will never take baked and brown substances with alcohol. But in India,
Okay.
they will take pakora,
All
chicken pakora,
all fried.
things.
All fried actually.
So
Yeah.
that makes the alcohol poison.
Acha, you mean to say that, sir, along with alcohol, whatever we are having, chicken, tikka, all other fried things, and these two things are much.
Even peanuts, they are really the culprit, those who are increasing your hypertension more. If you kept on taking 2 packs,
Okay.
maximum 3 packs with salad thrice in a week, you will be fine. Accompanist food, dishes,
Yeah.
what you call snacks,
Yeah.
they are more dangerous. Full
But
of advanced glycation end products,
Okay.
AGEs, and they will start damaging you like anything from day one. So your blood vessels will get damaged.
But people say that if anybody is drinking without having any stuff, they say that don't do that, your stomach will spoil, better you have food also along with alcohol so that you can be all right.
So have food. No, salad is also food, Subbu.
Okay, I got your point. Not the fried thing
So
actually.
I saw one Telugu movie
Okay.
where Balakrishna was mixing idli and with wine and taking it.
Yeah, I agree.
So
Correct.
that remember that movie was Narsimha. So
Correct.
question is, if you take the foods those who are good which you take regularly, those who are not going to add to the calorie,
Okay.
not going to add to cholesterol,
Okay.
not going to add to AGE,
Yeah.
then alcohol is fine. It is going to help you
Okay.
relaxing yourself mentally.
Okay.
So the NMDA receptors in the brain and
Okay.
GABA.
Okay.
So first alcohol will induce sleep. You are going to be relaxed. Your willingness will go up.
Correct.
NMDA receptor will regulating that will help you improve the positive neurotransmitter. It will disinhibit the negative feelings.
Okay.
So it is all good. Question is
How much?
how much?
That is more
With
important.
what?
Okay. Okay.
This is whole journey. Now, if you go, then alcohol increases chance of diabetes, increases chance of hypertension, increases chance of stroke, everything.
Yeah.
But the question is, how did you handle alcohol? So, as Shakespeare said, alcohol is your pet or you are alcohol's pet.
Acha.
So, let alcohol do good to you, not do bad to you.
Okay.
So, and second thing, culturally, most of the people will smoke when they drink.
Okay.
So the one beautiful thing as told by Shakespeare, you are making it horrible just because of not alcohol but something else.
Along with alcohol.
So this is a myth which people have.
Okay.
And doctors also when they address only alcohol.
They don't address these issues
So
actually.
the real issue is not the 2 pegs of wine or 2 pegs of whiskey.
Okay.
The real issue is what you are taking together.
That stuff thing.
Yeah.
Okay.
So people have to go for boiled peanuts,
Okay.
salads.
Okay. Boiled peanuts are good, sir.
Yeah, they will also inhibit absorption if you take them together.
Acha. So you mean to say that instead of taking the chicken and fried thing,
Yeah.
better you take salads and then
Boiled peanuts.
and then it is good for
Yeah,
vegetarians.
take onion, raw onion.
Then, sir, the
Excellent.
vegetarian drinkers, it is good only, I think.
Then why the hell someone needs to take wine as well as non-veg? If you really a connoisseur of wine
Correct.
or alcohol, take it, but enjoy it. And then you don't require to drink pint after pint, pint after pint.
Correct.
Right? But remember, hypertension will be caused only when you take very high quantity. And then not only hypertension, you will get CAD also, you will get cardiomyopathy also, you will get diabetes also, everything.
Okay.
Because of whatever you are taking along with
alcohol. Now I have one more query, sir.
Yeah.
Person is already having blood pressure.
Yeah.
He has to take BP tablet daily.
Yeah.
So he is taking BP tablet and he is a alcoholic also.
Yeah.
I mean, can he take tablet and alcohol together or else he should give
together. No, there has to be gap of alcohol of 2 hours minimum.
2 hours.
2 to 3 hours is better.
Okay. By the time drug is going to be absorbed.
Yeah, no.
So
So better you take the drug, let 2 hours pass,
Okay.
and then you go for drinks. In certain conditions, your BP may fall drastically if you
Okay.
take less. But ultimately, there could be some interaction. Ultimately, all the drugs are organic compounds.
Okay.
And ultimately, acetaldehyde is an organic compound,
Okay.
which is toxic also and reactive also,
Okay.
though it is short-lived. So there has to be a gap
Okay.
period of time.
Okay.
But be careful with alcohol, all the hypertensive, because there might be fall in BP.
BP will come down actually.
Yes, it will come down.
Okay, sir.
Right. So certain people, there are cases where people, those who had history of arrhythmias,
Okay.
they should be very careful with alcohol, not be on one pack.
And one more query, sir. If the people have the family history of cardiac arrest and kind of issues, they are still suffering with blood pressure.
Yeah.
Is it advisable for them to take alcohol?
See, alcohol in low quantity everybody can take.
So you mean to say that people can have alcohol but limited quantity?
In extreme moderation for those people who are in risk. The only thing is that people are not able to control because of the weakness of alcohol, that is tolerance. Intoxication level you got with 2 peg today,
Okay.
you will require 3 to 4 pegs tomorrow.
Tomorrow.
And this is how it becomes dangerous.
Dangerous.
If you are really disciplined, if you are limiting it to 1 peg of whiskey every day,
Daily 1
and
peg of
fully
whiskey
diluted.
also fine.
Remember, if you take lot of water along with it, is the damage is going to be almost negligible. Or even carbonated drinks. But if you take carbonated drinks, they are bad for your health
Correct.
because lot of sugar.
So it is better to take along with water only.
Yeah, water.
Thank you, sir. Thank you for valuable information. So friends, you heard what Shashi sir is saying. Take alcohol in moderation. And the very important thing that you need to remember is that when you are taking alcohol, better to have peanuts or maybe some salads instead of having all the fried food like fried chicken, fried mutton, fried eggs. Sir is saying that alcohol along with these fried things is more dangerous. And he also says that daily taking a small glass of wine or whiskey doesn't cause any harm. But when the quantity goes beyond the limit, that is where you get elevated blood pressure. So take care of your health. Don't drink too much. And please give the gap between your BP tablet and alcohol. Thank you very much.